Hello YouTubers. If you're watching this video, you're probably thinking about getting a total disc replacement using the Mobi-C device. So the reason I'm making this video is because when I was looking at what I was going to do for my surgery, I found the YouTube videos to be very helpful. So I wanted to give back to the YouTube community. So a little quick background to my symptoms. About 4 months ago, I started experiencing numbing and tingling in my left shoulder. I thought it was muscular, went and saw my chiropractor, my massage therapist, and then when that didn't help, I finally went and saw some specialists. And after a series of tests, it was determined from my MRI that I had a compressed nerve due to a bulging and collapsed discs at my C4 and 5 and my C5 and 6. It's pretty serious. They basically said if I had any whiplash action in my neck, like I fell down the stairs or even just took a bad fall, I potentially could have been paralyzed from the neck down. So I was pretty quick to look at my surgical options and get my surgery. Thankfully, here in the North Carolina area, which is where I live, we have access to some of the best physicians in the country. So I went over and I saw literally the #1 ranked fusion doctor in the country over at Duke University Medical Center. After sitting with him and going through a consult, I was pretty convinced that fusion was the way I wanted to go. He would have to do a 2-level fusion, but based on his reputation and based on his knowledge, I felt like that was going to be the best decision for me. I even scheduled my surgery, and then when I got home, I kind of thought about it and said, you know what, I really need to get a second opinion. I was talking to a good friend of mine, and he suggested that I look at the Mobi-C implant. So I did my homework on the Mobi-C, looked at the clinical data, read some of the medical journals, and the results, as you probably are aware if you've been looking into this, are very good, especially if you're looking at having to get a 2-level fusion. The results with the Mobi-C implant are superior for 2-level fusions or situations where you would get a 2-level fusion with the Mobi-C implant. So I am literally 1 day after surgery. I had my surgery yesterday, about 7 in the morning. Took about 3.5 hours. When I woke up from my anesthesia, I felt great. The numbing and the tingling was gone in my shoulder. Others on YouTube have said that they've had a little bit of a sore throat because obviously they have to cut in your neck and move your vocal cords over, as well as put a tube down your throat during general anesthesia. But my throat really isn't that sore. I feel actually really good. I haven't had to take so much as a Tylenol at this point because there really has been no pain. Really, the most difficult thing is having to wear this collar whenever I'm moving around. If I'm sitting or stopping to eat, I certainly can take the collar off. But if I'm up and about, I've got to wear this collar, especially if I'm in the car. Even though I'm not allowed to drive, I can certainly get in the car with somebody else driving, at least until I see my post-op visit with my surgeon, which would be, I think, 13 days from now. So far, I couldn't be happier with the results. Like I said, my pain is gone. The recovery, while it's only been a day, is better than I expected. I mean, I've had workouts where I've been more sore. The muscles around my neck are a little bit sore, but again, there's no pain, nothing that, for me at least, required having to take my Percocet or even a Tylenol at this point. So I couldn't be more thrilled with at least the recovery to date. What I'm hoping to do is post a couple more videos, maybe right after my post-op visit here in about 13 days. Probably do one at 3 months and 6 months and a year because I found these videos to be really helpful. But if you're thinking about the Mobi-C implant, I would definitely say, do your homework, look at some of the other videos on YouTube. They certainly helped me out. But from my experience, if things continue to go the way they do, I'm going to be thrilled with the results. For me, the Mobi-C was all about keeping mobility. I know if I did a fusion is forever, right? Once you do a fusion, you can't undo it. And there's going to be adjacent stress above and below the fusion site, which will really limit your range of motion. I'm a pretty active person. I'm 37 years old. I'm otherwise extremely healthy. I'm an avid rock climber. I train in Brazilian Jiu-Jitsu. So I do put a bit of stress on my neck between my physical activities. And so I wanted to be able to get back to that. I didn't want this injury to limit me from being able to do that. And I felt like the Mobi-C implant gave me the best course of action to potentially get back to those activities. For me, if the implant goes bad in 10, 15 years, I think that was the one thing my fusion doctor had said is the reason he didn't want to do a replacement is because there's no good long-term data on it. And while that's certainly the case, the 5 and 7 year studies have been fantastic so far. So for me, I kind of said, you know what, if I do a fusion, I can't undo it. If I do a disc replacement and it doesn't work, or in 10 or 15 years there's a problem, At that point, there's either going to be a newer disc or a newer technology, right, medical procedure that I could do, or I could go back to the fusion, right? So I'd rather have the option to go to a fusion if I needed to, rather than do a fusion first and know that at that point I cannot go and do anything else. So again, you know, one day in, literally 24 hours from when I had my surgery, and I feel great. You know, I said the worst thing is a little bit of soreness, but not enough to even take any medication. And again, maybe the collar is the most inconvenient thing that I've got to do right now, but otherwise feel great. So I'll be back in 13 days or so to kind of give an update after I see my post-op visit. But so far, so good.